Joining us now, Dr. David Donaldson from the Beaumont Troy ER Center. It says, Dr. Donaldson, you are the Vice Chief of the ER in Troy. Thank you for joining us.
Thanks for having me. I appreciate it.
Well, it's good to have you here. So before we get to the news of the day, you're Beaumont Troy. It was a big day in Troy, so I spend my afternoons in Troy every day. I had no idea that what happened yesterday afternoon in Troy happened until I got out of the office at the end of the day. Were you aware? Did you see the traffic and the protests yesterday?
I was the same way. I learned about it after I got home.
So we didn't see that going on, but it was just one of a number of gatherings that have been going on. And as a Troy person, I hope you don't mind me asking something a little bit out of your area of expertise. Wasn't it great yesterday? I mean, we have so much to be worried and concerned and problems to deal with. Wasn't it great to see our Troy police officers get down on one knee, meet the protesters in middle ground, and now we are the shining example for the country. Doesn't that feel good?
Yeah, I agree. I mean, anytime you can protest peacefully and show solidarity between both sides, I think it's a great thing.
So we were talking to the folks out at U of M a little earlier, just in this hour, and one of the things we were talking about is people taking care of their own personal health as maybe another spoke on the wheel. You got the mask, you got the washing, you got the social distancing, but now that a variety of medical services are available, is it a good time to get back to some of your own personal health issues that might be helpful to get sorted out before we have another wave, if we do?
Yeah, I mean, absolutely. And that's part of the messaging that I wanted to get out there, is that it is safe to come to the hospital. We take every measure possible to keep you safe. In fact, at Troy, we have a nurse stationed outside of the emergency center. So when you arrive in your car, you are screened in your vehicle before even getting out. And if there's any suspicion that you may have COVID, you are actually brought out of your vehicle and into a separate entrance directly into a room. Never come in contact with anybody that potentially doesn't have it. So we segregate anybody that could potentially have COVID away from the general population, for sure.
Dr. David Donaldson is joining us from the Beaumont ER Center, and well, that's good news. And we've been hearing that from the other hospitals and medical facilities that we've been talking to, that they're just not seeing cases of people that are coming in to be treated for issue B leaving with COVID. And I assume that you keep track of that kind of thing, and we're just not seeing those cases.
No, that's correct. We get daily updates on our COVID numbers in the hospital, and it's a handful right now. And I quite honestly haven't seen a sick COVID patient. I mean, I've seen several COVID, not a lot, but a few, but nobody that's been sick like we saw several months ago. The severity, and I mean, I would basically say that curve is definitely flattened and is on the decline right now.
We talked to the researchers at U of M, but good to hear from you as well. You have a different perspective on this. Do you think, Dr. Donaldson, given what you've seen, given where we are, because you were looking at this thing right in the face of it several months ago, do you think we need to be concerned about influenza in the fall, the return of COVID in the fall, that we're going to see a spike, and that is around the corner for us? Your thoughts?
I think influenza, yes. I mean, especially in emergency departments, every year come about November, we do see spikes, and mainly that is due to influenza. So that will happen. COVID, I mean, this is new for everybody. I think we have to err on the side of caution. I am very reassured, though, what's happened recently with some of the measures being lessened in Michigan and other states, that they've not generally seen the big spikes. Italy is another good example that haven't seen the big spikes after the social distancing requirements have let down a bit. Some of that may be the summer months and the warm weather, but I think it's a definite good sign. So to answer your question, I think we have to have our guard up, but I'm reassured by what we've seen so far.
So, Dr. Donaldson, let's just go back to a little bit of basic, when do I go where? And we all forget, and it does make a difference. When should we go to the ER? I mean, we have the COVID scenario in there. For a while, it was don't come unless you're COVID or really in serious trouble. But getting back to normal times, when is it a good idea to head to our ER?
I mean, whenever you have what you determine is an emergency, and that can be chest pain, stroke-like symptoms, even like the ankle sprains and the arm injuries and everything, we've been seeing a decrease, and it's just really crazy the amount of the decrease that we've seen. Some of it can be explained, I think, without youth sports and things like that. Obviously, we're not seeing the youth injuries, but some things just can't be explained. The heart attacks, the strokes, even things like appendicitis have been like 50% reduction over this COVID times. And to me, that just means people are staying home and not coming in.
All right, Dr. Donaldson, I'm going to weigh in on that one because, and forgive me, I laugh. I'm just trying to keep this thing light as we can. But, okay, so Jeff, my producer of the show, he had his ankle was messed up. Should have gone in, didn't go in. Okay, it's getting better. You got to decide whether a sprain for you or a sprain for me is going to be different. I get that. But I have had appendicitis. I cannot imagine having a full-blown appendicitis attack where you are vomiting profusely, just to be honest, and then not going to the ER. Is that what you think is going on?
Oh, I do, because we're seeing those patients weeks down the line when now it's perforated and they've got big-time problems when it could have been taken care of a week or two earlier. So I think these things are happening. People are not coming in. They're starting to now, but for the last couple of months, it's really kind of eerie, if you will, the amount of these things that you cannot explain that weren't coming in.
I always thought a perforated appendix, not to get off on a tangent, was a fatal scenario. Am I being over dramatic?
No, it certainly can be. The mortality when your appendix perforates goes up exponentially just from a simple appendicitis. So what can be treated in the first, couple days as a simple procedure now can be catastrophic.
All right. Are you hearing that the docs are having an opportunity, just that the general internists and family doctors are getting caught up with their patients? Or if you haven't been able to get in, is it appropriate to call the ER or is that inappropriate?
Well, I think, first of all, with the primary care docs, talking to my colleagues, they are working hard and they're getting their patients back and they're doing it safely as well. But that said, they are working extra days to try to catch up with their patients that, put things off for the last couple months. In terms of calling the ER, it really is a personal decision. You can certainly call your own physician to get advice. If you call the ER, the advice is going to be to come in because we can't very well screen emergencies over the phone. So if you think you have a medical emergency, I would tell you to either call your own physician or to come to the ER for treatment.
Dr. David Donaldson, Vice Chief at Beaumont Troy ER Center, with us today in the MegaCast. We thank you very much for joining us. Just to kind of measure where we are with the coronavirus, I look at the traffic every day, and yesterday it was hard to pull out onto Maple and Crooks like it always used to be. For the first time, I'm thinking, oh, man, I'm going to wait 10 minutes to get back on the road. So I see things getting back to normal. You probably can measure that, too, by people walking into your ER. Can't you?
Oh, for sure. And our just to give you a sense, our volumes at peak COVID time, so, beginning of April, were about 50% of our normal compared to last year volumes. And again, those patients with those diseases were staying home, and some of them weren't having good outcomes. Now we're starting to see a trend back. We're currently at about 75% normal pre-COVID volume. So people are starting to feel safe and come back. And again, that message just has to be that if you have a medical emergency, we have a safe, place to see you.
And it's not just your ER, it's ERs all across Oakland County. I mean, you got to get back in if you're having a problem. And it is safe. You're not going to get exposed to COVID. So don't put it off anymore. Go ahead and get in and see your doc. Dr. Donaldson, are we ready if we do see, as we open up our state of Michigan and open up Oakland County, and we do, God forbid, have another spike? Do we have the swabs? Do we have the PPE? Do we have the testing? Are we in better shape for round two if it appears?
Yeah, we're in 100% better shape. There's a lot of lessons learned the first run through this. I mean, we were all new at this and thought what we did, was best, and we were doing what we could do. But we have a lot of lessons learned, even from the medical treatment to the way that we supplement oxygen, to the way that we use our PPE. And to answer your question, we have plenty of PPE right now. That wasn't the case a couple months ago when we were scrambling, but we do now. And the tests are there, yes.
Did physicians need to isolate themselves in many cases from their families?
In the beginning, everybody had their separate little process of what they did. We would never leave the hospital in clothes that we treated patients in, so we'd always change in our scrubs. My personal process was I got home, I stripped down in the garage, went straight to the shower, showered, and got a new set of clothes. So anything that I even had in the hospital never made it into my house.
All right, but I assume now the reason I ask, I assume no one is doing that anymore. There's just no need, or is some of that still going on?
Oh, no. We all, as far as I know, all of my colleagues continue that. And in fact, today I'm just here doing administrative work, so I'm not even seeing patients, and I still follow the same routine. I'm just overcautious about it. I don't want to bring anything home.
All right, well, just make sure you got your pants on when you go out to cut your grass after stripping down in the garage, Doc. See, I could get confused, Tyler. That could happen to me, and then I'd have a whole other COVID-19 problem. So anything else, forgive me, anything else you want to share today that is of concern that people need to be aware of, Doctor?
No, I mean, I want to say thank you to the public because the message was to stay home unless you really needed us during the peak. And I think that did a wonderful job in flattening this curve. But I also think there was, some collateral issues with that, with people that were afraid to come in. So I just want to get out there that it's safe. I don't want to overshoot if there is another peak. So we have a safe segregated area if you don't have any infectious symptoms, and that goes all the way from the ER through your entire hospital stay. We don't mix COVID and non-COVID together.
All right. Well, good news. Thank you. Thank you for joining us. And back at you, Dr. Donaldson. We will always remember the heroic work done by the medical community, the doctors, the nurses, and then everyone at every hospital and medical care facility. Goes even beyond the medical practitioners. You guys, this was a war, still is. But you were all on the front line and taking risks, and we can look at it now. But you had no idea what you were in the midst of in those first days, and you did it because you had to do it. And we are greatly and forever appreciative. Thank you very much.
Thank you. I appreciate that.
Dr. David Donaldson, the Vice Chief at Beaumont Troy ER. Thank you very much for joining us today on the MegaCast.